Hello, and welcome back to HealthSource of Ohio's More Than Medicine podcast. I'm your host, Jim Patrick, HSO's Community Relations Director, and today we'll be recognizing National Nurses Day by sitting down with Melynda Iles, HealthSource of Ohio's Director of Care Management and Quality Indicators. Melynda has been in healthcare for several years. She worked at our Washington Courthouse location as the practice manager for 8 years before becoming the Director of Care Management in 2018. Melynda oversees a diverse team of care managers and coordinators who assist patients in achieving better health outcomes. Melynda is passionate about self-care and believes you can't show up for others unless you put the work into becoming your best self. She prioritizes herself by focusing on her health and her family. Melynda loves spending time with her husband, her daughter, and her fur babies. Let's dive in. Hi, Melynda. Welcome to HealthSource of Ohio's More Than Medicine podcast. Can you tell us why you decided to become an RN and walk us through your journey to become one?
So I didn't go to college right away. I spent my career in healthcare when I first got out of high school. I started out in a hospital-based facility, graduated myself through just admission work at a local community hospital and started in central scheduling. And about 8 years into that job experience, I figured out, I kind of know what I want to do with the rest of my life. So I entertained the thought of going back to school, and nursing seemed to fit my family's lifestyle. Couldn't go to school full-time right away, juggling family life at home and other responsibilities. But once I decided to break it down and get serious about school, the RN degree was my passion. So doing many things with that RN degree is what led me to believe that it's going to fill, not only job satisfaction, but also a requirement of, being able to be with my family as much as possible.
Fantastic. So I can tell that you're very passionate about being an RN, and that's led you to kind of wear many hats here at HSO. Can you walk us through the roles you've had here and how you ended up where you are now as our Director of Care Management and Quality Indicators?
Oh, sure. I started out as an emergency room nurse at a local community hospital in Fayette County. And I had a friend of mine who was a nurse practitioner, and she asked me if I wanted a job. And I said, well, I kind of have a job as a nurse already. And she's like, well, we need a practice manager at our local family practice office. So and listening to her and her great reference of the HealthSource organization, I decided to seek it out and apply as a practice manager at HealthSource. So I was the practice manager for about 8 years and came to be the Director of Care Management about 2 years ago.
Fantastic. I imagine having that RN experience and then bringing that to the practice manager side, I imagine that's very valuable. So I know that you bring a lot of a wealth of information to HealthSource, and I know that you're very passionate about what you do. So we'll dive into a little bit more about the care management team when we come back. Okay. Great.
HealthSource of Ohio's Outreach and Enrollment Team offers free assistance to all community members with Medicaid, SNAP, and Marketplace applications. With the current Marketplace special enrollment period and the new American Rescue Plan advantages, call us for assistance in reviewing your current plan and to see if you qualify for increased tax credits that lowers your monthly premium. Call the Outreach and Enrollment Team at 513-707-9901 today to schedule your appointment.
Welcome back. We're here with Melynda Iles, HealthSource of Ohio's Director of Care Management and Quality Indicators, discussing her and her team's role in creating healthier, happier communities, one patient at a time. Melynda, as the Director of the Care Management Team, can you tell us more about your team and their responsibilities?
Sure. So on the team, we have 5 RN care managers. We have a substance use care manager, and we also have a diabetes educator. That is, those 3 things are very prime components of our care management team. We also have care coordinators, which are LPNs and medical assistants, and those are 2 prime components of a care management team. We're very lucky to have a very large care management team with being a federally qualified health center in rural Southern Ohio. So having this robust team, we're very fortunate to have that role in most of our primary care practices. So one of the things as far as social determinants goes that we experience in our rural communities is transportation. we are still battling patients who have social determinants barriers that lead to transportation issues, whether they have multiple appointments and no ride, or they do have a ride and not enough money for their gas. We really try to help patients solve through that and walk them through what is the best opportunity for them to get to, the next point in their care. So we need to discover more affordable rides for them. We have a list of community resources that we reach out to and get those rides scheduled. Unfortunately, we live in communities that Uber and Lyft can't reach, or if they do reach, they're not the best cost option that we could have for our organization and our patients. So we constantly are striving for more access and resources to those facilities that are around us, and not only to bring patients to our primary care locations, but also if we refer them to a specialist or certain treatment centers, that we want to make sure that they get there and get the care that they deserve and need.
Absolutely. When I talk about the care management team, I oftentimes say that you're the connector. And I think it fits in very well that you're on the More Than Medicine podcast, because your team really does provide more than medicine. So you're kind of that middleman, you're discussing it with their clinician, you know what they need healthcare wise, but you're helping them navigate the real world situations that they're often faced, and whether that's the transportation issues you discussed, or choosing between which prescriptions they're going to use. And yes, you need your diabetes medications, but you can also control it better if you do a certain diet, or if you know how to control your A1C numbers. So it's education provided with connecting them to those resources you mentioned. So I don't know that other healthcare centers have that option. So I'm just so thankful that you guys are there to help our patients navigate those real life situations.
Sure. And we may not know the answer every time, but hopefully some of those resources will get them to that next point faster, and hopefully discovering that better health outcome a lot faster than what they would have if they hadn't interacted with us. A lot of time with addressing these social determinants, you have to know what your populations are experiencing, and knowing is half of the battle. So once we get the know, then we can move forward with how can we help.
Absolutely. Healthcare should be a two-way conversation between the patient and the clinician. It's not always telling the patient what they need to be doing, it's hearing from them what they need. And I know that your team has been a huge part in developing the Hunger as a Health Issue program, developing care closets in the offices, people who need hygiene items to, you need that to live your best life and to show up as your best self. So your team has been incredibly just a foundation of that, and you're truly more than medicine. Melynda, it is so obvious that you and your team are passionate about addressing those social determinants of health and helping all of our patients. But can you tell us a little bit more about how your team impacts overall population health?
So our care team works those patient discharge lists when the patient's coming out of the hospital, reaching out to the patient, connecting them to our primary care clinicians, or whatever services that they need post-hospital discharges. That's very important work. We are hoping that they reduce readmissions. We want to make sure patients stay out of the hospital as long as possible. So we're hoping that transitional work will help the patient seek that better health outcome post their discharge. They also coordinate care through quality improvement projects, preventative cancer screenings. Those cancer screenings that your clinicians have been wanting you to have for maybe the past year, maybe the past 2 years. You're still due, and you still need to go and get that done. Yeah, absolutely. And then also they identify certain populations that may not be having or experiencing the best quality health outcomes that they could be. So, for instance, the diabetes population, there's so much in treating that chronic disease, and it's different for every person. So we try to identify who potentially could need help and reach out to them and referring them to a diabetes education program. We have one here at HealthSource that we're very proud of. So we try to keep most of that work in-house so we can keep them connected to their primary care clinicians as much as possible. but we also can help manage the patient through their other chronic diseases as well with chronic care management. So you don't have to have just diabetes if you're needing extra help with some other chronic conditions like high blood pressure or stroke or seizures. We can help patients discover what's important to them and seeking that better health outcomes, staying on top of their goals and connecting them to care, whether it be reduced medications or transportations, like we mentioned before.
So beyond just, addressing the social determinants of health, I really think that you guys are viewed as a teammate in our patients' healthcare. So you're making sure that they're coming to their preventative care appointments. They're making primary care a priority, because if you do that, you're going to avoid those bad health outcomes out down the road. So that's the goal. And then I also just think that your team brings such a compassion and empathy to everything that they do that our patients just gravitate towards you. And while clinicians are very knowledgeable, sometimes you need that kind of warm handoff to someone who can talk to you and just really, really help you navigate the situation. So that's your team. We can talk about, like, this podcast will probably be, in the 15 to 20 minute range, but we could probably talk for hours about all the things that your team does and does well. So thank you for that insight on what the care management team's about.
HealthSource of Ohio offices are open, safe, and here for you. We offer family practice, pediatrics, OBGYN, vision, and pharmacy services. We accept most insurance plans and offer a discounted sliding fee for uninsured patients. Go to healthsourceofohio.org for a complete list of locations and services. We're accepting new adult and pediatric patients now, and we welcome back our former patients. HealthSource of Ohio, quality care, leaders in wellness.
Welcome back. In celebration of National Nurses Day, we're sitting with one of HSO's registered nurses discussing her and her team's role in your health. But did you know that in addition to National Nurses Day, May is also recognized as Mental Health Awareness Month? With that being said, I thought it would be nice to hear from Melynda on how she prioritizes her own health when so much of her day focuses on the health of others. Melynda, what are some of the ways that you prioritize your physical and mental well-being?
So I here recently have been experiencing a lot of stress, which I'm sure everyone is familiar with. But some self-reflection, and one of my new ideas that I'm trialing is finding out what makes me truly happy and doing more of that, and making sure that I've set aside dedicated time to be able to make sure that happens, that happiness happens. So being more intentional with my own reflections and figuring out what is truly making me happy, and in the long run, is this going to continue to be good for me. But trying to find ways to promote taking care of myself, and it might be an 8-ounce glass of water extra that day because I've deprived myself and it's just been coffee all day long. So it could be as simple as just an extra glass of water, or hey, I really need to take the day and just focus on myself and do those self-care things that you kind of put aside. But yeah, finding out what makes me happy and doing more of that, and scheduling time if I have to be able to make sure it gets done.
Absolutely. I think that's something we all overlook, is actually putting it on the calendar, making time. If you put it on the calendar and something comes up, okay, fine, that's all right. But you've carved out that time, and if it's there, you're more likely to do it. So I need to take that advice and do that myself. And I think that's especially important in the context of the last year. It's easy when you're in a pandemic and everything's on fire, especially in the healthcare world, to kind of put your health on the back burner. And when you don't necessarily have anything on the calendar like we used to, we don't have the dinners with friends as often, and we don't have those things that we built into our time. You have to be far more intentional, like you said, about carving out that time about what makes you happy and what brings you joy. Well, Melynda, this has been really good information. You gave us a lot to think about with the care management team, but I also love that you take that time for yourself. It's so important for you to take care of yourself if you want to show up for others. And I know that you do that well. So I thank you for that. As we conclude this episode, I want to give you an opportunity to share one last time, like, what are the top 3 things you wish people knew about healthcare?
So I wrote them down, and I wanted to make sure that I said exactly what I wanted to say. So impact what you can change and change it. Just make the time to motivate yourself and do what you can. There's so much in this world that we cannot change and we cannot feel like that we can impact. So find out those things that make you happy and impact and make those changes. Also, HealthSource has many great locations, and there's a clinician waiting to see you. So if you need to find someone, we can connect you with that care. And then also, like I said before, that screening test that you need, go ahead and get it scheduled. It's okay. We'll make sure we get it done for you.
Yeah, that's so important. And I'm guilty of that. I put that off, and sometimes I'll put off my doctor's appointment because I don't want to admit to them that I've put that off. But they're not going to judge you on that. They just want what's best for you, and they're just going to encourage you to take those little steps, like you said, every single time. And I think our clinicians, but also our care management staff, is so good at helping people navigate that and just taking that first tiny step, whichever direction, to make this health outcome. So
one at a time.
Yep, one at a time. I love it. All right, well, Melynda, thank you so much for joining us today. I hope that we can have you back on a future podcast episode. And thanks for all that you and your teams do. I hope you have a fabulous National Nurses Day. It's one day is not enough to celebrate all that you do. So we celebrate you guys every single day. What you do truly makes an impact, not only on our patients, but your teammates, our communities, and all of HealthSource of Ohio. So thank you so much.
Absolutely. Thank you.
And last, but certainly not least, thank you, listeners. I hope you've enjoyed our time together today and that you'll take some time to celebrate the nurses and healthcare workers in your life each and every single day. We hope you'll tune in again for our next episode, and be sure to follow HealthSource of Ohio on all of our social media platforms. Please subscribe to the More Than Medicine podcast on any of your favorite listening apps. Until next time, please remember, together we can create healthier, happier communities, one episode at a time. Thank you.